You've been told that taking probiotic is one of the simplest, safest things you can do for your gut. That if you've just finished a course of antibiotics, you should reach for one on the way out of the pharmacy. That the bottle with more strains and a bigger CFU number is the better bottle, but I want to tell you that what the actual evidence says about that, because in cases I've reviewed, the women who bring me their probiotic bottle have almost always been taking something that was never studied for the symptom they bought it for. Hi, I'm Dr. Shat Abdullah, and this is the episode I wish I could hand to every woman standing in the supplement aisle. I built Blue Yarrow because I want to share my naturopathic doctor training and knowledge so that people who aren't getting answers from conventional doctors can find the answers with me. The probiotic conversation is one of the cleanest examples of that gap. Now, the conventional gastroenterology world has gotten very cautious, and the American College of Gastroenterology, in their 2021 IBS guideline, suggested against probiotics for global IBS symptoms. The EA limits its endorsements to a very short list of indications, but then you walk into Whole Foods, right, and the shelf is 50 bottles long, every one of them whispering that it will fix your bloating, restore your gut after antibiotics use, rebalance your hormones, and the more strains it has, the better. Both of those positions are wrong in their own way. The literature actually has a concise answer, and you can read it once you know what you are looking for. So here I want you to walk away from this episode able to do three things. One, you'll understand why the question is not, is this a good probiotic, but is this the strain at the dose that has actually been studied for what I am dealing with. Number two, you'll know which specific strain have tier 1 evidence for which problems by name. And three, you'll know how to read a bottle so you can tell whether the thing in your hand is the thing that was studied. And this last skill is the one that will probably save you the most money. Now, a quick note before we get into it, a full transcript and a deep dive blog version of everything I cover here can be found at blueyarrow.org. So save them or come back to them after the episode. There is a lot of strain code and dosing detail in this one. You may not remember all of it, and you shouldn't have to. Now, let me back up a little bit and explain what is actually happening. In the literature, because the contradiction between the major guideline body says and what the wellness content says is not exactly random, it comes from a methodological problem that nobody is really naming clearly enough. When the AGA reviewed the probiotic evidence in 2020, they used something called GRADE. It is a strict framework that asks whether the evidence is consistent across trials, whether the trials were well designed, and whether the effects are clinically meaningful at the population level. Using the framework, the AGA recommended specific strains for three narrow indications. So prevention of C. diff in adults and kids on probiotics, prevention of necrotizing enterocolitis in preterm low birth weight infants, as well as maintenance of remission in pouchitis after colectomy. That is essentially the entire list they had. They did not endorse probiotics for things like IBS and other gut issues. College of Gastroenterology, in their 2021 IBS guideline, went one step further, though, and they suggested against probiotics in global IBS symptoms. So, conditional recommendation, very low quality of evidence in their own words, but it is a recommendation against it regardless. And then you have, wellness Instagram where every creator with a brand deal is telling you to take a probiotic for everything from acne to immunity. So, which is it really? Here is what I've come to think about is both sides are answering different questions. The guideline bodies are asking if we pull every probiotic trial together and treat probiotic as a category, does the category beat placebo? And the answer to that question mostly is no. The wellness world is asking, are there individual probiotic strains that have been shown to help individual problems? And the answer to that question is definitely yes, for a short specific list as of right now. And I'm sure there's more and more research coming up. The reason both sides talk past each other, though, is that nobody is naming the unit of analysis. Here, the unit is not the probiotic supplement itself, but the unit is the strain. This is the foundational piece, and once you understand it, the rest of the conversation gets a lot simpler. There is a 2018 systematic review by Lynn McFarland published in Frontiers in Medicine that scoped 228 probiotic trials and concluded that strain specificity and disease specificity are real and not just a theory. As what the data shows across hundreds of studies, the exact same genus and species can have completely different clinical effects, depending on which strain you are talking about. So, Lactobacillus rhamnosus GG and Lactobacillus rhamnosus G1, they are both the same species but different strains. They have been studied for different things at different doses with different results. So when you're pulling them together in a meta-analysis, it's like pulling ibuprofen and acetaminophen together and just calling them painkillers. Technically true, but clinically it can be pretty useless. So when you stand in front of a probiotic bottle, the question that actually matters is not the genus or species specifically, but the strain code that is attached with that bacteria. So, for example, you can see something like B. longum 35624. Or you might see something like L. plantarum 299V as another strain. So those identifiers are the part that has been tested in trials. Without that code, you do not know exactly what you are taking. Now, let me give you the number that I want you to actually hold on to from this segment. And that is S. boulardii CNCM I745. This type of yeast cuts antibiotic associated diarrhea from 18.7% to 8.5%. And this was done in a randomized clinical trial. That is one specific yeast with one type of commercial identifier and with one specific indication that was studied for. So right now, it's not really recommended for things like bloating in general, gut restoration, immune support. So those were not the things that the trial tested for. But, in the future, there may be more testing and we find out it does other things. But at the moment, it's mostly recommended for diarrhea associated with antibiotics. I want you to notice something that I just talked about because it is what a real evidence claim looks like. Specific strain, specific dose context, and the outcome. Compare that to what is on the front of most probiotic bottles, which is usually something like supports digestive and immune health, 50 billion CFU, 10 strain for women's guts. There's no specific strain code that they advertise in the front. And even if they are there, they're probably buried on the back panel with really small font. And the other piece of the science worth naming is what probiotics are actually doing in your body. There is a mechanism story that helps everything else make sense. So, probiotics rarely permanently colonize the gut. They're not setting up a new neighborhood inside you most of the time. What they are doing in most cases is they are producing what's called short chain fatty acids, especially one called butyrate that supports tight junction proteins integrity at the intestinal lining. So they are competing with pathogens for adhesion sites. They're nudging the immune system at the gut lining, and these are transient effects. So stop taking the probiotics, and within a few weeks, if not days, the effect is largely gone in most people. That is not a flaw, that is just how these probiotics work. But it does mean that the framing of take this probiotic to permanently fix your gut is not what the mechanism is supporting. Oh, this matters for one of the most common questions I get, which is whether you should be taking probiotics every single day for the rest of your life as a general health practice. The honest answer from the literature is that we do not have long-term safety data beyond about 12 month-ish in healthy adults. So most of the trials in this entire literature ran 4 to 12 weeks. So, at the moment, there is not exactly super strong evidence that, it's beneficial if you take it for the rest of your life, or it's harmful. So we just don't have enough data. So if anyone is telling you with confidence that daily probiotic use is safe long term, just take that with a grain of caution, please. Okay, that is the framing. Strain specificity is very real, and there's a lot of research backing it up. And to recap where we are, the reason you cannot find a clean answer to what is the best probiotic is that the question itself is shaped wrong. So the right question is, what is the strain that has been studied for the exact problem I am trying to solve? The dose the trial used for the duration trial used it for, that is a question you can actually answer. So coming up next is I want to walk you through which strains have evidence for which problems by name. I want to read you the labels you should be looking for, and I want to tell you the one pattern I keep seeing in cases that I've reviewed, and that is honestly the single biggest reason most women's probiotic experiments has not worked. So stay with me. If you've ever bought a probiotic for bloating, taken it for 3 months, watched your symptoms stay exactly the same, or even get a little worse, then, you quietly threw the rest of the bottle in a drawer, feeling like you wasted your money, I want you to know I have seen this pattern over and over in the people who reach out to me about gut health. So most women come with multi-strain probiotic they've been taking for years for bloating, and not one of the strains in that bottle has been studied extensively for IBS at the dose they are taking it. And here's the thing, bloating is definitely a symptom, but IBS is more of a label at the moment. The strain that has been studied for IBS bloating in women is not the same strain that has been studied for antibiotic-associated diarrhea. And it's not the same strain as the one that has been studied for perimenopausal hot flashes. So when wellness creators say probiotics are good for women, what they're saying is something like this category of supplement, somewhere inside of it, has products that have been studied for things some women have. That's not exactly a good recommendation. It's more of the marketing. And I'm not saying that everything is that way, but most of the time that is the case. So let me give you the names because this is the part, the supplement aisle doesn't really tell you in plain language. You kind of have to dig through it to find the answer. For IBS, where the symptom you are dealing with is abdominal pain, bloating, bowel dysfunction, one strain with the strongest evidence at the moment is Bifidobacterium longum 35624. You may also see it called B35624. So the taxonomy got, reorganized in the last decade and both names are still circulating. So just be aware of that. And as I've been mentioning over and over again, the strain code 35624 is the constant that you should definitely be looking out for. Now, the original trial that established it was Peter Warwell in 2006 study in the American Journal of Gastroenterology. He enrolled 362 women specifically, gave them 10 to 18 CFU per day for 4 weeks, and saw significant improvement in abdominal pain, bloating, and the composite IBS score. So that trial has been replicated in the 2023 network meta-analysis by Gujari and Gastroenterology. Ranked B longum 35624 high for individual symptom relief in IBS. So when I tell you what the literature points to for IBS bloating, that is the strain it is pointing to at the dose that I mentioned and for at least 4 weeks. So B longum 35624 was used around 10 to 18 CFU per day for 4 weeks. The second strain with strong IBS evidence is Lactobacillus plantarum 299V. The original trial was done by Silin, I hope I said that right, in 2001. It was a small study, but the effect was pretty clean in the replication by Crot in 2012 with 214 patients. Definitely held up over 4 weeks for abdominal pain. So the dosing in the trials was 1 to 2 capsules a day for 4 weeks, and the 18-week data, is more RIX, which is its own clue about how to use it. Now, for antibiotic-associated diarrhea, which is one of the indications the AGA actually endorses, the 2 strongest strains are the Spolardi C and CMI 745 that I mentioned, a little bit earlier, and Lactobacillus rhamnosus GG. Both have multiple reviews and meta-analyses behind them. And S. boulardii is technically a yeast, not a bacteria, which is part of why it is really interesting. So it does not get killed by the antibiotic you are taking alongside of it. Thing else for pouchitis maintenance, which applies to much narrower group, the strain blend is VSL number 3. So if you have had a colectomy and a J pouch, this is the one the AGA supports most at the moment. So for perimenopausal vasomotor symptoms, which is the hot flashes and night sweats and disrupted sleep that the 41, 45 cohort tends to be searching for, the 2025 menopause meta-analyses pooled 7 are randomized clinical trials and found a large effect on vasomotor symptoms with multi-strain lactobacillus plus Bifidobacterium formulations. The strain composition varied across trials, which is the caveat here. The signal is real, but the exact strain recommendation is not yet confirmed. So if you're in perimenopause and curious about this, the honest framing is that the literature is pointing somewhere, but the trials are still happening. They are pulling heterogeneous formulations, and a strain standardized study would tighten that picture for sure. There was a 2025 meta-analysis is not the final word, it is a strong signal. For bacterial vaginosis, when used as an oral adjunct to antibiotic treatment, the strains most studied would be L. raminosus GR1 plus L. reuteri RC14. There are positive trials, and there's at least one null cohort study from 2021. So I would call the evidence medium, not high, on this one. Okay, so that is a strain by condition map. Notice what is not on it. There is no entry for general digestive health or immune support or specific probiotics for women. I would definitely, they're not exactly clinical categories with strain level evidence. And in a clinical setting, that's really the most helpful for doctors and patients, is knowing the evidence, the strain, and not just a pretty packaging with really strong marketing. Now, I want to give you the part that I think is the most useful, which is how to read a label so you can tell whether the bottle in your hand contains the strain you are looking for. When you flip a probiotic bottle to the back panel, you are looking for three things. One, the strain identifier, the string of numbers and letters after the species name. So, like B. longum 35624. If there's no strain identifier on that label, you do not know what you're taking. B. longum alone does not tell you the strain. Number two, the dose at the end of shelf life, not at the time of manufacture. So see if your numbers degrade. A bottle that says 50 billion at manufacture might be actually 10 billion when you open it. Number three, third-party testing. So that includes testing from USP, NSF, or consumer lab verification. And this matters because of, the second piece of evidence I want to give you in this segment. And that is up to 73% of probiotics products, they fail their own CFU label claim in quality control studies. I want you to sit with that number for a second. 73%. The Markobel paper and the follow-up quality control studies that have been done since looked at commercial probiotic products and tested them against their own label claims. And up to 73% of them unfortunately failed. Some products had 0 viable organisms, while the label claimed 14 million per capsule. And about 32% had species misspelling on the label. So even if you have read this whole episode, memorized the strain map, walked into the supplement aisle, and picked up the bottle with the right strain code on it, there is a real chance the bottle does not contain what it says. So that's why third-party testing matters more than the brand's reputation. Third-party testing is one of the few verifications of what is actually in that bottle. So when someone asks me, should I take this probiotic, and they hand me a bottle, the conversation in cases I've reviewed almost always goes to the same way. I look at the strain code, there's no strain code, the conversation ends there. The bottle is unspecified, and you cannot match unspecified to evidence. If there is a strain code, I look up what that exact strain has been studied for, at what dose, for how long, and in what population. If the dose on the bottle matches the studies, the duration patient's willing to take it for, and the indications they're buying it for matches the study outcomes, then that bottle is, I know for certainty, doing something good for that patient. So if any of those those four things don't line up, the bottle may be doing something else, which may or may not be helpful and is definitely not what the trial showed. So that is most of what I want you to take from this segment. The strain code is the part that has been studied. The dose has to match the duration, the indications, they all need to looked at and compared with the evidence that we have at the moment. To the practical, what to actually do part of this episode, I want to read something a listener sent me because it is a perfect example of the pattern I keep running into. So she wrote, I read on TikTok that probiotics can backfire if you have SIBO. I have been taking one for 6 months for bloating, and now I'm scared I made it worse. What do I do? Now, I want to answer that one directly because if you have a small intestinal bacterial overgrowth or SIBO, which is when bacteria that should be living, more in the large intestine kind of set up shop higher up, or the small intestines bacteria itself just have gone out of control. Probiotics can sometimes worsen your symptoms for sure, particularly if the formulation has things like prebiotics in it, because the prebiotics, they're feeding the bacteria that are already in the wrong place. There is observational data, including a 2018 paper by in Clinical and Translation Gastroenterology, showing an association between probiotic use, D-lactic acidosis, and brain fog in a subset of SIBO patients. So that's not a randomized controlled trial grade evidence. It's more of a clinical signal worth knowing about. I definitely do see these type of symptoms in clinic as well, like joint pain, brain fog associated with SIBO. It can definitely happen. So if you've been on a probiotic for 6 months and your bloating is the same or worse, the answer is not necessarily a different but probiotic. Maybe it is, or maybe it could be stepping backward to ask whether there's a deeper issue going on, such as SIBO. And a way to test that is doing a breath test, which gives you data your symptom of bloating alone does not give you. So before you buy the next bottle, talk to your doctor whether to do this workup or not. That is one example of how this whole conversation can flip when the underlying physiology is something other than what the marketing assumed. I want to take everything I just told you and put it into a form you can actually use this week. This is the part where you can pause the episode, save the page on blueyarrow.org, or just take a screenshot. The card is called Which Probiotic for Which Problem. It's a short list of the strains with tier 1 evidence, the dose that was studied, the duration of that study, and the confidence level on that study. So if you are interested in seeing that, definitely check out my website. You will find that there. I'll also try to attach a link if I can. So look out for that. But if you can't find it, definitely, if you just go to my website, blueyarrow.org, you will find it there. Here is what I want you to do this week. Just one thing, if you have a probiotic bottle in your house right now, I want you to take it out of the cabinet and flip it to the back panel. Find the strain codes, if there's even one there, the numbers and letters after the species name. And then I want you to ask yourself 3 questions. 1, is there a strain identifier, or is it just the genus and species with no code? If there is no code, that bottle is not specific enough, and you should definitely dig deeper into the claims that it is claiming. 2, if there is a strain code, does it match one of the strains on the card I told? 2, if there is a strain code, I want you to look at that strain code and the card that I mentioned that is on my website and see if you can find it there. See if it is actually treating the problem you are using it for. 3, is the dose on the bottle anywhere close to the study dose? And have you taken it for the duration that is recommended? And if you did answer yes to all those questions, your bottle is definitely doing what it should be doing, and you definitely got a really good product for yourself. But if there's a lot of no's, then maybe reconsider and talk to your doctor about what's the next best course of action to take. And what I want you to take from this episode at the broadest level is that probiotic conversation is not probiotics good, probiotics bad. Not pharma versus nature. It's it's a strain by strain, indication by indication, dose by dose, label by label. That is more sophisticated answer than the supplement aisle wants to give you. And it's also the answer that respects how much progress the field has actually made. So you have to read closely to find the answers you are looking for, unfortunately, because most of the time we're just not told the right answers. And once you have it, the supplement aisle gets a lot easier when you walk through it, when you know what you are looking for. And before I let you go, the standard reminder, this content is for educational purposes only, and it is not medical advice in any shape or form. So please consult with your healthcare provider for individual recommendations. The decisions about what supplements to take, especially if you're pregnant, immunocompromised, or on multiple drugs, have complex gut diagnoses, those decisions belong in a room with someone who knows your full medical history. What I can do here is translate the literature, but what you may need is someone who can translate that into a plan for your specific physiology. So those are 2 different jobs. And in the next episode, more on the root causes of the symptoms women keep being told are normal. So I'll see you in the next episode, and I hope you enjoyed this one. Please let me know if there was any questions that you had or things you enjoyed that surprised you. I would love to hear from you. Okay, till next time.